Hi everybody, Dr. Suneel Dhand, internal medicine physician. We had some breaking news from the United Kingdom today. England looks set to scrap the COVID-19 vaccine mandate for healthcare workers. This is an absolutely huge story. I've been following it closely for the last several months. And I remember when it was first announced, there was a lot of pushback from many different quarters, including a lot of doctors' organizations. I'll come to that in a moment. Over the last few weeks, there's been a lot of concern about critical staffing shortages if this mandate went into effect. I believe it was due for April. But anyway, the government has now decided that they're not going to go ahead. And one of the reasons, I'm sure that staffing factored into it, but one of the other reasons that they are reported to be giving is that Omicron has really been a game changer in terms of how we think about COVID-19. And there was actually an incident which got a lot of attention a few weeks ago, where a frontline physician who was working on a critical care unit, an ICU doctor, since the beginning of the pandemic, actually confronted the UK Health Minister, Sajid Javid, about this policy. This doctor, Dr. Steve James, is unvaccinated, and he talked to Sajid Javid about his thoughts on how this mandate was not the right thing to do and how he would lose his job if the mandate went into effect. I urge you all to go online and look at the video of this confrontation. Then last week, I actually saw an interesting headline in the Times newspaper of the United Kingdom, a very well-respected newspaper. Doctors join waiters in turning down COVID jabs. Doctors are among the health workers least likely to be vaccinated against COVID-19, while fitness instructors, artists, and waiters have some of the highest unjabbed rates overall. I was actually very surprised with that headline. I wonder if it applies to British doctors in America too. That's a joke. But I can tell you that the NHS COVID vaccine mandate got so much pushback from doctors' organisations in the United Kingdom. The Royal College of General Practitioners, that is family practitioners in the United Kingdom, the Royal College of Obstetricians, the British Medical Association, the British Medical Journal wrote about their concerns with COVID-19 vaccine mandates, and even nursing associations were voicing a lot of concern about this policy. A TV doctor in the United Kingdom, his name is Dr. Hillary, and I have to say I don't agree with a lot of what he says, but even he made a statement saying that he didn't think the COVID-19 NHS vaccine mandate made a lot of sense. Compare the response of medical authorities in the United Kingdom with medical authorities in North America, in countries like the United States and Canada. It has been quite different, and needless to say, I'm very proud and I completely agree with the concerns voiced by UK medical authorities against mandatory COVID-19 vaccination policy for healthcare workers. Think about this as well. In healthcare, I know one can make the argument, of course you want people to be protected. And remember, vaccine mandates are very different from vaccine programs. Vaccine programs encouraging vaccinations is one thing, but vaccine mandates are another. And think about this as well. Healthcare workers, doctors, nurses are wearing personal protective equipment. They're wearing masks, they're wearing N95s, they're wearing face shields, they're wearing gowns, they're wearing gloves. And you're almost saying that that is not enough to prevent infection, when actually it should be if we're all wearing our PPE correctly. And many healthcare workers have already had COVID-19. Many have had it over the last few weeks as well, the Omicron variant, which has spread so rapidly. The number of absences in the NHS was astronomical. So I leave you now with this thought. So many traditional Western liberal democracies have over the last few months embraced the concept of mandates. And since when did it become more un-British than it is un-American to have mandates like this? Since when did that happen? Because the United States certainly wasn't like this a few years ago. Vaccine mandates are not a big thing at all in the United Kingdom. There are, as far as I'm aware, no mandates for school children, for universities or most workplaces. And I think most of Great Britain would be shocked to learn that in a scattering of US cities, which unfortunately includes some of the largest US cities like New York City right now, you can't even take a 5-year-old into a restaurant without presenting a vaccination card. To me, that is shocking, and to a lot of the rest of the world, it is shocking as well. But right now, mandates are much more un-British than they are un-American. So for those of us who have wanted for a long time to approach COVID-19 with a much more rational, reasonable, and logical approach. We have had only a few victories, but we will certainly take this victory, no matter how small on a worldwide scale. It is a victory for common sense and logic, and it is certainly what many of the medical authorities in the United Kingdom were saying as well, that the NHS COVID vaccine mandate should not go ahead. Thanks everyone for listening. Let me know your thoughts down below. Dr. Suneel Dhand, MedStoic Lifestyle Medicine. You can follow me as well on locals.com. It is an uncensored platform. We'll speak again very soon.